Hello everybody. Today we are going to see the unboxing of Siemens DCA Vantage Analyzer. This is a point of care analyzer. The main clinical use of this analyzer is diabetic monitoring and kidney disease screening. This is the package of Siemens DCA Vantage Analyzer. You can see the brand name over here, Siemens DCA Vantage Analyzer, and you can see the analyzer picture over here. This is an IVD product, in vitro diagnostics, and you can find that this product should be maintained in 5 degree to 40 degree Celsius. And over here you can find the reference number 06651932, and you can see the manufacturing details at the bottom. This is a C certified product. I'm just going to unbox this for your reference. You can see that the product is completely safely packed. At the top you can find DCA Vantage power cord instruction manual. You can find the brand name Siemens. I'm just going to place this aside. After that you can find the operation guide for DCA Vantage Analyzer. This is the operation guide. Here is a CD drive for DCA Vantage Analyzer documentation. You can find the CD drive. This comes up with an operation guide. I'm just going to place this aside. After that you can find an operation guide for DCA Vantage Analyzer. You can find the reference number 10282134 and brand name Siemens. This operation guide is completely safely packed. I'm just going to place this aside. Here is the quick reference guide for Siemens DCA Analyzer hemoglobin A1C. You can find this reference guide for hemoglobin. This is how only you load the sample and you can get the result for HbA1c. I'm just going to place this aside. After that you can find the quick reference guide for Siemens DCA Vantage Analyzer microalbumin and creatine. You can find how to collect the sample, how to load the sample in capillary tube, how to insert the capillary in cassette, and after that how to scan the cartridge and how to insert the cartridge and how the result would be. All the reference details are given in this quick guide for DCA Vantage Analyzer microalbumin and creatine. I'm just going to keep this aside. After that you can find that unpacking guide for Siemens DCA Vantage Analyzer. This comes with an introduction and procedure how to follow the unboxing, and here you can see that what are the content present inside the box. It comes up with an DCA Vantage Analyzer and cleaning kit, operator guide, optical test cartridge, NA power card for system, Euro power card for system, UK power card for system, and replacement fuse, air filter replacement kit, HbA1c quick guide, microalbumin creatine quick guide, documentation CD. These are the content present inside the box. I'm just going to place this aside. This is the power card for DCA Vantage Analyzer. Inside the pack you can find an air filter, 2 pack of air filter 400 series. It comes up with a brand name Siemens and reference number 03168350. So this is the air filter for DCA Vantage Analyzer. I'm just going to place this aside. After that, you can find a Siemens DCA cleaning kit. It comes up with a 10 cleaning kit with a reference number 06488209. You can find the brand name over here, Siemens, and it's a 10 cleaning kit. It's completely sterilely packed. I'm just going to place this aside. And 2 printer papers for DCA Vantage Analyzer. I'm just going to place this aside. Now you can find 2 number of fuses. This is a backup fuse. You can find the brand name Siemens and fuse pack and reference number 04469001. I'm just going to place this aside. After that, you can find the power cord for DCA Vantage Analyzer. Here you can find the 3 type of power cord: NA power cord, Europe power cord and UK power cord. For DCA Vantage Analyzer, based on your requirement, you can choose any one of this. I'm just going to place this. Now we can just take out the DCA Vantage Analyzer. You can see that the analyzer is completely safely packed inside the package. I'm just going to take this out. This is the Siemens DCA Vantage Analyzer used for microalbumin and HbA1c test, and you can find the display over here. And here is the part you can insert the cassette with sample, and you can find here is the place you will scan the calibration card and cassette, and you will get the printout of the result over here. And this is the front view of the analyzer. I'm just going to show you the side view. This is the side view. You can find the manufacturing details over here. This is the back view of the analyzer. You can find the power button, and here is the place you will insert the power cable. This is the back side of the analyzer. Over here you can find the brand name DCA Vantage Analyzer, Siemens, and manufacturing details. This is the complete overview of Siemens DCA Vantage Analyzer. To summarize it, inside the box you will get an Siemens DCA Vantage operation guide and a CD documentation of DCA Vantage Analyzer, 10 DCA cleaning kit, 2 printer roll, 3 type of power cables, 2 2 air filters, 1 operation guide for DCA Vantage Analyzer, 1 quick reference guide for Siemens DCA Vantage Analyzer hemoglobin HbA1c, 1 quick reference guide for Siemens DCA Vantage Analyzer microalbumin and creatine, an unpacking guide. These are the overall content present inside the box. Thank you.
Hello and welcome to this instructional video for using the Siemens DCA Vantage. The DCA Vantage is a semi-automated benchtop system and is designed to quantitatively measure the percent of hemoglobin A1c in blood. This video will cover components, calibration, sample analysis, controls, and instrument upkeep. Firstly, let's get familiar with the components of the Vantage. On the front, we have the onboard barcode reader, the printer on top, the display screen, and the reagent cartridge compartment. On the back, there are connections for LIS data export, the power switch on the bottom, and the power cord next to it. Next, let's talk about calibration. The DCA Vantage system is calibrated every time the calibration card is scanned. Scan the calibration barcode before using the reagent cartridges, as each calibration is for a different lot. Now let's get started on sample analysis. Scan the HbA1c calibration card rear barcode from top to bottom past the dot on the onboard barcode reader. An audible beep and notification will appear on the display screen after a successful scan, and press OK to accept. Next, open the reagent cartridge package and set to one side. Open the sample capillary packaging by peeling the cover off, careful not to press on the middle of the capillary as it may snap. Use anticoagulated sample and invert multiple times before using the blood in the lid to fill the sample capillary. Use a tissue to wipe the outside of the capillary of excess blood. Orienting the upper curved edge of the capillary outwards, snap the capillary into the reagent cartridge. Scan the reagent cartridge and capillary tube assembly in the onboard barcode reader. Now enter the access code using the display screen, either with your finger or with the stylus. The access code will be an individual code for each user that will be set up in advance. Once the access code is accepted, insert the reagent cartridge into the reagent cartridge compartment with the barcode facing to the right until an audible click is heard. Holding the edges of the cartridge firmly, pull the foil tab out of the reagent cartridge and close the reagent cartridge compartment door. The Vantage will now prompt you to add the minimum requirements for patient details, including patient ID, last name, first name, and any comments you may like to include. Once the fields with asterisks have been filled, hit OK to accept and wait for the countdown timer to finish to read the results display. If you require a printed copy of the results, hit the print key. Hit the send key to digitally export the result to the LIS. Once you have the results, hit the next key, and the display will prompt you to remove the reagent cartridge. Do this by pressing the white button on the right of the cartridge tab, and gently pushing the cartridge to the right while simultaneously pulling it out to disengage the clip. Close the door and you're done! To ensure the sample result is accurate, normal and abnormal controls need to also be run. The procedure for running controls is the same as patient samples. Before running controls, the control card barcode for the control that you intend on loading needs to be scanned, so that Vantage recognises and calculates the acceptance criteria for the correct control lot number. Lastly, we would like to include a few instructions to address common issues that may arise during analysis. 1. Barcode cannot be read by the onboard barcode reader. The barcode reader window may be dirty and can be wiped clean using a lint-free cloth with water or ethanol. If difficulties in scanning are persistent, consider installing an external barcode reading wand which may help. 2. Onboard printer is not working. If there's a paper jam or if there's no paper left on the roll, please follow these steps. Use the tab to lift the cover off. Locate the printer paper release lever. Pinch and lift the front of the lever to raise the paper guide. Lift the paper feeder up. Push the plastic paper cover down. Carefully pull the paper through the printer. Remove the paper roll and remaining paper on the roll. Obtain a new paper roll. Unroll sufficient paper to feed the printer. Hold the roll just above the printer with the paper unrolling from underneath. Push the paper gently through the roller at the back of the printer. Load the paper into the paper feeder. Push the plastic tab to cover the paper. Pull the paper feeder down. Pinch and push down on the grey paper release lever to hold the paper in place. Load the paper into the paper slot on the cover and close the cover. Thank you for watching this instructional video for using the Siemens DCA Vantage.
How to QC hemoglobin A1C. Check expiration date on the hemoglobin A1C controls and cartridge. Check hemoglobin A1C meter for readiness. Open the box, get a cartridge and a capillary collection device out. If is a new cartridge box, scan the new calibration card. Still controls before using. Scan the normal green side of the card. Apply normal control sample to capillary collection device. Make sure there is no gap or overflow the capillary device. Insert capillary collection device into the cartridge. Slide the cartridge in the bay for scanning. With the barcode facing the reader, open the meter door. The meter will instruct to insert the cartridge in the system until click. Then pull the foil tab out. Close the meter door. The test will take about 6 minutes to result to pass. Normal result will show when test pass. Click Next. Meter will instruct to remove the cartridge. To remove the cartridge, open the meter door, press down the white button, and at the same time push the tab to the right and pull. Close the meter door. Click OK. Scan the abnormal blue side of the card. Apply abnormal control sample to capillary collection device. Make sure there is no gap or overflow the capillary device. Insert capillary collection device into the cartridge. Slide the cartridge in the bay for scanning. With the barcode facing the reader, open the meter door. The meter will instruct to insert the cartridge in the system until click. Then pull the foil tab out. Close the meter door. The test will take about 6 minutes to result to pass. Abnormal result will show when test pass. Click Next. Meter will instruct to remove the cartridge. Open the meter door. To remove the cartridge, press down the white button, and at the same time push the tab to the right and pull. Close the meter door. Click OK. And this is how you QC the hemoglobin A1C meter. Thanks for watching.